Greetings to all of you. Let me first start off by saying I think we should pay respects as the Minerals Council to our 712 colleagues that unfortunately succumbed to COVID over the course of the last 2 years. We've also had something like 52,000 positive cases in the mining sector over the course of the last 2 years also. Imagine what the outcomes would have been if we had actually had the vaccines to implement a lot earlier than we're doing so at the moment. But our great thanks to the 235,000 workers in the mining sector that have been vaccinated, at least their first shot. This is about 52% of the total mining labor force. And this is a very, very big step in the right direction from our particular perspective. I can just say to all of you that the Minerals Council's management team is 100% double vaccinated, and our entire overall team is 85% vaccinated. We did have a couple of colleagues who couldn't be vaccinated because they had COVID. They had to wait for the mandatory period before they could be vaccinated. So we're also trying to lead by example. Working with the National Department of Health and B4SA and in close cooperation with our members and our trade union partners, we have more than 70 vaccination sites working, and all of this towards supporting getting as many of our colleagues, friends, and workers vaccinated to help us fight this pandemic. Why are we doing this? In my view, the only way that we're going to get out of this pandemic crisis is when a significant portion of our population is vaccinated against COVID. And in my view, it has to be more than 80%. At the global level, the countries that have high vaccination rates have opened up their economies and are growing at a much faster pace than those who have a much lower vaccination rate. And so those countries that have done the vaccinations are recovering much faster. And by the way, at the global level, there are 6.7 billion vaccines that have already been administered. In countries like the United States, they've had great success with getting a significant portion of their populations vaccinated. But they have a pandemic at the moment. It's a pandemic in people who are unvaccinated. And it's very difficult to explain to someone on their hospital bed that they can't be given the vaccination. They should have got it earlier to prevent them from either being hospitalized or from dying of COVID. Remember that as we build up to the Christmas holiday season, we want as many workers as possible to be vaccinated to protect them and their families during the leave and travel periods. Also remember that your elderly family members and your youngsters can also get sick if you are sick, having been infected by COVID. There is a risk that we may go into the fourth wave, and that risk is one that would be devastating for livelihoods and for people's lives. And I just want to re-emphasize the point that young people also can get sick, very sick from this COVID pandemic. Vaccine preventative diseases are expensive. When you get the disease, hospital treatments are expensive. They also have a huge impact, not only on your health, but also on the economy and on livelihoods. So your family and your co-workers need you, colleagues. Are vaccines safe? Certainly in our view, absolutely. In South Africa, no one has died from having had the vaccine, and no one has developed COVID from having had the vaccines. In our view, the vaccines are very effective in preventing COVID-related serious diseases and death. People who are unvaccinated, and especially the elderly and those with underlying comorbidities, are much more at risk to serious disease and possibly death. So vaccines keep you healthy. Vaccines can literally be the difference between life and death. So what we're doing and what this all means is that we are supporting the government effort of the Vooma Vaccination drive. And we're doing that because we want to have as much and as great a share of our labor force and our communities vaccinated as soon as possible to enable us to open up our economy quicker and get back to some resemblance of normality in the post-COVID normal, new normal as we call it. And so we're very much aligned with the government Vooma Vaccination drive. Our members are all working very closely together to create greater access to the vaccination facilities for all workers. And so from the 18th to the 22nd of October, our membership are going to really emphasize the criticality of getting vaccinated and ensuring that we have as many of our workers making use of the opportunity to get vaccinated as we drive this process. And in our humble view, we believe that this is a significant step in the right direction, all working together with our trade union partners, with government, to get the vaccine process rolled out as quickly as possible. And we're not suggesting for a moment that anyone's going to be forced to have the vaccine. What we're suggesting is go there, do the right thing, get yourself vaccinated, save your life and save the lives of your colleagues around you, your teams and your families. So that's very much a message that comes from us as the Minerals Council. Thank you.